Hello and welcome to my channel. I'm Dr. Arshia, and today I want to discuss about the usage of cortisone, especially during this time that we are facing coronavirus infection. I came up with this topic because one of our Iranian ex-national team player unfortunately died from coronavirus infection last night. He was very young, 45 years old, and he was very healthy. But unfortunately, from the day he catch the coronavirus till the day he passed was very short, and the infection unfortunately progressed very fast, and doctor couldn't save him. But when I study about his past and what he has been dealing with, I came up with some interesting information that I want to share it with you. It may help and it may save you or your loved ones. So if you want to know more about this, you should follow me through this video. Let me clear the topic. This is about people who have not get the coronavirus infection yet. And this is not about the therapy of those critically ill patients that in the hospital doctor decide to give them cortisone, especially dexamethasone. So this story started, as I said, from the time that one of our national team player unfortunately catch coronavirus, and it progressed fast, and unfortunately he passed away. So when I study about his past, I found out that he's been on the cortisone therapy on a high dosage for the past 7-8 years. But finally he found out that it is not good for him, and he met another doctor and he found that that was a wrong prescription for his problem. Therefore, they stopped the cortisone. But the problem is, when you use cortisone for a long period of time, because it suppresses your immune system and it causes abnormal B cell and T cell, once you stop it, all of those systems do not come back to the normal state very fast. In one of the studies that I will leave the link to this study in the description, they study about those who getting very low dosage of the cortisone for 30 years. But after they stop the cortisone, it takes minimum of 2 years for them to go back to the normal state. Means during that 2 years recovery, still the counting of the white cell was low, and worse than that was these people producing abnormal B cell and T cell. So this causes immunodeficiency in all of these patients. So the recovery time is also very long. I understand, and you should also know that for some conditions, some people must take cortisone to be able to function and to be able to have a normal life. But the problem with the cortisone is during your intake, it suppresses your immune system. Therefore, you are more vulnerable towards coronavirus infection or any kind of infection. But the secondary part is that nobody really knows that once you stop the cortisone intake, still you need long time for recovery, especially if you have been in a long period of time on the cortisone therapy, even at the very low dosage. And for the football player that I mentioned, unfortunately he was at a very high dosage. So what should we do for this matter? Basically, I cannot recommend anything for you. I just can deliver the information to you that if you are on cortisone, this could be the result. And if you have been on cortisone for a long time and you stop it, still you are at danger of getting infection, especially coronavirus infection, much faster and more progressive compared to other people. So the only thing you can do, first, try to prevent coronavirus by following all the protocols as much as you can. Also, it's good if you can have a discussion with your doctor and follow their recommendation. Because I'm not recommending to anybody to stop the cortisone or not to stop the cortisone. I just give you the information, how does this thing can work and how can it really have a negative effect on COVID-19 infection. So that was for today. Please like and subscribe and share this with your friend, because this information could be very valuable and even save lives, save so many lives for those who don't know about this matter. So I wish you all the best, and I hope you all stay COVID-19 free. Till next time.